The quest to combat disease and improve the quality of human life has led to great advances in healthcare. And we are a privileged generation. Many of the most significant strides have been made in our own time.
It's been coined the graying of America. We're living longer than ever before, and for the first time in our nation's history, the single biggest demographic in this country will soon be people over the age of 50. The Centers for Disease Control estimates that a staggering 25% of Americans will be over the age of 50 in just the next 30 years, or just about 90 million of us. In the medical world, especially among those in the business of diagnosing and treating colon cancer, this translates to a potential 100,000 deaths per year in this country alone.
Colorectal cancer affects 17% of American adults at some point in their life. It affects individuals primarily over 40. It takes the life of approximately 55 to 60,000 Americans every year. And one concern with the aging of our population is that deaths from colorectal cancer could increase significantly, perhaps approach 100,000 in 20 years if we don't make further advances.
Though these numbers may not sound too promising for those of us on our way to being part of this gray-haired super demographic, those on the front lines are beginning to see light at the end of what's been a very long and dark tunnel. The arsenal of state-of-the-art colorectal cancer fighting technologies available today are providing medical professionals the upper hand and patients newfound hope in the ongoing fight against this equal opportunity disease. At leading cancer research and treatment facilities such as Rochester Colon and Rectal Surgeons, physicians are using the latest technological breakthroughs with great results.
We've learned that screening for colorectal cancer greatly impacts the survivability of colorectal cancer. What we've learned is, by using colonoscopy and some of the newer technologies, we've been greatly able to improve the prevention and cure rate for colorectal cancer.
While surgery is generally the most effective treatment option for a range of abdominal and other conditions, until recently, options for minimally invasive yet highly effective surgery have been virtually non-existent. Fortunately, it's the breakthroughs in surgical robotics that are providing some of the most promising benefits for colorectal cancer patients in all of modern medicine. Named after the Italian Renaissance genius of the 15th century, the daVinci surgical system is a breakthrough in medical robotics that allows surgeons to operate using only 1 to 2 centimeter incisions, yet with greater precision and control than ever before. Combining superior 3D visualization along with greatly enhanced dexterity, precision, and control in an intuitive ergonomic interface with breakthrough surgical capabilities, daVinci can help surgeons minimize the pain and risk associated with surgery while increasing the likelihood of a fast recovery and excellent clinical outcomes.
The high-definition 3D visualization affords far greater precision in difficult areas to access. For our patients, this means less discomfort, often shorter hospital stays, and most importantly, better long-term outcomes.
Last June, I was sent in by my primary physician to Rochester General for a colonoscopy, and they found a small growth, and it was cancer. That's when I met Dr. Rao. He came into my room and talked to me, explained all of this robotic surgery. He was very confident. He made me very comfortable, so I agreed to have it done that way. And the recovery time is wonderful. It's very short. I didn't have any discomfort. I really didn't. And I've been feeling wonderful ever since.
The bottom line is, in the fight against cancer, early diagnosis is still the key. And everyone beginning at the age of 50, both men and women, need to get screened for colon cancer. However, in the event you're one of the more than 60,000 Americans diagnosed with colorectal cancer this year, it's modern medical marvels like the daVinci robotic surgery system that are helping doctors give their patients the best opportunity for a cancer-free life. To learn more about the daVinci surgical system, contact Rochester Colon and Rectal Surgeons by calling 1-585-244-5670 or online at www.rochestercolon.com.